In this week's episode of Really Good Tips, we're learning more about preventing pressure injuries, and it's presented by Care Specialist and Clinical Services Manager, Lynn James. Today's Really Good Tips is brought to you by Permobile. Thanks, Permobile.
Hi, I'm Lynn James, currently the ACC Clinical Services Manager for Access Community Health. So pressure injuries, they're also called pressure sores or pressure ulcers, are one of the most common reasons for someone with spinal cord injury to have to return to hospital or unfortunately go onto bed rest for a prolonged period of time. Being on bed rest for a length of time can lead to complications like constipation, urine infections, chest infections and general muscle wastage as well. Unfortunately, you can't change your injury, but there are many things you can do to minimise the risk of having a pressure injury. A small red mark, a bruise, a scratch or skin tear can quickly develop into something much larger and difficult to manage if not treated early enough. What can you do to try and prevent a pressure injury? Firstly, I would say absorb all the education and information you receive when you first have your injury. Anything that's education, just absorb that. Have your family, friends, everybody that's going to be around you involved in that education. However, the most important person that can have all the education in the world is you. You're the one that can educate others and to tell others what to look out for if you're unable to do that for yourself. Learn how and where to check your skin or how to instruct your support person and ask them how it looks. Ask them to take a picture or a video and be able to describe that for you, or to hold a skin check mirror for you to be able to look at your own skin. When you leave the hospital, try and keep into a really good routine that they've instilled with you with your rehab team. Checking your own skin, asking support person to do that, or ideally do that twice a day. Keep up a really good routine of doing your own pressure relief or asking somebody to help you, ideally every 20 minutes for at least 30 seconds each time. If you do have to go into hospital for any reason once you're home, make sure you take all of your pressure relieving equipment with you, or advise the hospital ahead of time if you can what you need. Ensure you drink plenty of water and have a diet rich in protein and good healthy fats. Chickens, avocado, fishes, nuts and seeds are excellent. Skin likes to be hydrated and nourished. Skin really moisturised using a non-perfumed lotion, concentrating on drier areas like your feet and elbows, and rub in gently. What you can ask yourself now is, am I actually confident in checking my own skin, or can I instruct my support person or family member to do that? Do I know what I'm looking for and what to feel for? Do I know what to do when I get a pressure injury and who to contact? You can refer to the Back on Track book and the staff at the Spinal units for more information. If you are still concerned, you might want to speak to your support staff or your doctor.